Hello guys, welcome back to my YouTube channel. I am Divya, CPC certified medical coder, and today I'm going to explain the most important topic, that is spinal surgery. Without any further delay, let's get started. And it's come under the musculoskeletal system. Okay, so it's a very huge topic. Okay, so coming to next. So, what do you mean by the spinal surgery? What is the reason behind this to do the spinal surgery? So we can say that the spinal surgery is a surgical procedure which is performed on the spine, vertebral column, or that the back to treat the condition affecting the vertebrae, intervertebral disc, and spinal cord or the nerves. Okay, so these the vertebrae, intervertebral disc, spinal cords or nerves comes in these are the parts of the spine. Okay, so the spine consists of this is a spine. Okay, so this spine consists of the several regions you can see here. That is the cervical region, thoracic region, lumbar region, sacrum, coccyx, which is in pelvic area, and coccyx, which is also known as the tailbone. And this is in the neck region. Thoracic is in upper back. This is in upper back, and the lumbar is in lower back. Okay, so the spinal surgery may involves the bone, disc, ligament, nerve, spinal cord, instrumentation. So we'll see this all in the details. Okay, so first, most important, that is the basic. Why is spinal surgery done? What is the reason? So these are the following reason you can see here. So the herniated disc. Okay, so the herniated disc, which is in the slipped disc, when the disc comes out and presses on a nerve. I will show you. This is in spine. Okay, this is in spinal region. These are the disc. These are the vertebrae. You can see here these are one, two, three vertebrae, and every vertebrae there is a disc. Okay, and so look this. You can see here the disc presses on the nerves and it causes the pain. Okay, it causes the numbness in that region. Okay, now coming to second one, that is the spinal stenosis. This is the spinal stenosis. So in the spinal stenosis, what happens? The spinal canal become narrow. The spinal canal become narrow, and nerves get compressed, and the cause pain and difficulty in the walking also. Okay, and surgery also done for this to create more spaces for the nerves, as there is a narrow in the spinal canal. Now next, that is spondylolisthesis. Spondylolisthesis, that is, and one of the vertebrae slipped over another. You can see uh, this is in spondylolisthesis. One of the vertebrae slips over another, cause the pain and nerves compression. Okay, and the next, that is degenerative disc disease. Okay, so the degenerative disc disease, wear and tear. So what do you mean by this? So the spinal disc wears out and aches and causes the chronic pain and the instability. And by the surgery, it will relieve the pain and stabilize the spine if needed. Okay. So next, that is an spinal fracture. That is a spinal fracture. That is a spinal bone breaks because of the injury or the osteoporosis, which can damage the spinal cord or the nerves. Okay. Next, that is scoliosis and the kyphosis. I will show you what is scoliosis and kyphosis. This is in spine curves abnormally. Okay. This is in kyphosis. You can see here this region is humped. This one looks like that. And in the scoliosis, you can see the normal vertebrae, and the scoliosis vertebrae, scoliosis spine, you can see here this one. So it's in bad posture. Okay. So the next that is in spinal tumors, and the tumors grow in around the spine. Okay, and presses the spinal cords or the nerves. And the next one, spinal infection. Infection damages the bones or the discs, and the causes the pain, and it may spread also. Spinal instability, that is the spine moves more than non-normal. Okay, so the spinal surgery, we can say that to remove the presses on the nerves and reduce the pain, correct the spinal problems. Okay, um, and make the spine stable so the patient can move, function better. Okay, this is a tumor in the spinal canal. This is a normal disc. You can see here. This one is vertebra. This one is a normal disc. This was a normal disc, and you can see here. This is a degenerative disc. This is a bulging disc. This is a herniated disc. This is a thinning of the disc, and this is the osteophyte formation in the that one that is in the disc. So these are the spine uh, instability. Okay, so these are the reasons. That's why the spinal surgery is done. Coming to next. So before going to do the OP reports, before going to what are the procedures done, what are the ICDs, what are the CPTs, what are the diagnoses, and all this thing. Before going to this, we have to know the basic anatomy of the spine. Okay. So first of all, the spine, which is also known as the backbone. You can see this is a spine, and we can say that the vertebral column, and it provides the framework to our central body parts. Okay, and it extend from the base of the skull. This one you can, this is the skull, and from the base of the skull and to the pelvic region. Okay, it extends from the base of the skull and the pelvic region, and it also supports the weight of the head, neck, and the trunk, and it protects the spinal cords. So what is spinal cord? So spinal cord, which is inside the vertebral column. Okay, we'll also see that what is spinal cord. So the vertebral column, there is 33 vertebrae. From here to here, there is 33 vertebrae, in which there is 24 vertebrae which is movable, in which the 7 is cervical. Here to this region contains the 7 vertebrae, 7 cervical vertebrae, 12 thoracic vertebrae, 5 lumbar vertebrae, and these are movable, and which consists 24. And the next, that is an pelvic region, which consists of the sacral and the coccygeal region, which are fused. Okay. Um, in the baby, there is a sacral which is not fused, 5 in number, and in the coccygeal also in the baby there is an not fused, separate vertebrae. Okay, but when the baby growth, okay, so these two reasons, pelvic region vertebrae get fused and 1 in number. So this is a basic formula: cervical 7 in number, T12 in number, lumbar 5 in number, sacrum, that is the 5 in number, or we can say 1, and coccygeal, that is in 4 in number. Okay, so do you ever think that why spine having the curves, and what if these spines are straight? If these spines are straight, then it is in difficulty in walking, in moving, in sitting. That's why spine having the curves, and there is in 4 curves. First curve in the cervical region, second thoracic, and third one that is lumbar, and the fifth one that is pelvic. Okay, 1, 2, 3, 4. So there are 4 curves. Okay. So and the it is in spinal column is the 70 centimeter long, and it made 33 individual bone, which is known as vertebrae. We already seen, and these bones forms the protective hollow tunnel. Okay, these having the hollow tunnel. For example, this one is the vertebrae, spinal column. Okay, and it makes the protective hollow tunnel, which known as a spinal canal, and where the spinal cord runs directly. Okay, between these vertebrae, between these vertebral column, there is an between these vertebral column there is an hollow tunnel from which the spinal cord runs. Okay, so and every vertebrae, for example, this one is the one vertebrae, two vertebrae, three, four, whatever the reason, cervical or lumbar or any reason. Okay, so between every vertebrae there is a disc present, and this disc is cartilaginous disc. In every vertebrae there is a disc, and this disc is known as the intervertebral disc. Okay, which provides the flexibility, mobility to the vertebral column. And there are 23 discs. Okay, there are total 23 discs. Based on the location, there these 33 vertebrae divided into five groups already seen: cervical C1 to C7, thoracic T1 to T12, lumbar lower back L1 to L5, sacrum pelvic base, that is S1 to S5, which is fused, coccyx, that is tailbone, CO1 to CO5, which is fused. So one thing most important, for example, if I say that lumbar 1 to lumbar 2, okay, here the L1 and L2 are the two segments, okay, but having the one interspaces, okay. Between two vertebrae, there is an one interspaces. For example, next L1 to L2, L2 to L4, okay. So here L1 to L2, L2 to L3, okay, this one is 3, okay. So here there are these are the segments, okay. L1, L2, L3 are the segments, but that is two spaces, okay. L1 to L2 first, L2 to L3 second interspaces. By mistake there is an 4, but here is 3, okay. So one by one we'll see these vertebrae, okay. So first the cervical vertebrae. The cervical vertebrae, which is in the neck region, okay, and there is C1 to C7. Cervical vertebrae is 7 in number: 1, 2, 3, 4, 5, 6, 7, okay. And there are these cervical vertebrae is one of the most smallest and the most flexible bone in our entire spine. And the first two bones, that is, this one is C1, this one is C2. So first bone is known as the yes bone, okay. The C1 is known as the yes bone. Why? Because it is also known as the atlas. We can say this is an atlas, and the first bone that is in our top of the neck, and in this the skull sit here directly on C1. And when we just nod our head up and down to say yes, so that's why it's known as the yes bone. The second C2, this is known as the axis. This is the second bone, and it's having the odontoid, that is C2 axis. This is an tooth-like structure which is known as odontoid, and that's why this is known as the no bone, okay. And when we move our head left or right to say no, that's why it's no, okay. So in every this one I have shown the rough diagram of the cervical vertebrae. So this one is cervical vertebrae 1 to 7 in number, and in the one of the vertebrae here it is shown that C1 and this is T2. So in C1 or every vertebrae, just one taken here, there is an small two holes, which is known as the transverse foramina. Similarly here, these are the two uh, holes which is known as the transverse foramina, and in every C1 to C7 there is a transverse foramina, okay. And this red line which is known as the subclavian arteries, from these transverse foramina, the arteries, pair of arteries uh, move, okay. And these two are vessels reaches to our brain and join one artery, okay, which is known as the basilar artery, and it provides the oxygenated blood to our brain. Okay, so these are the arteries, subclavian arteries, and these reaches these joins together in our brain, which makes an one big vessels, which is known as the basilar artery, and it provides the oxygenated blood to the brain. Okay, so simple. Next one, you can see here, that is an cervical vertebrae, C1 to C7, C1 to C7 in number. This is an vertebrae. In between this, there is a disc, and there is an odontoid process. This C1 from C1, the skull pointed here, and so in the next, now let's see next one. Thoracic vertebrae. This is a thoracic vertebrae which is present in the chest region. Okay, and that is an upper back, we can say, and this is in T1 to T12. So their number is T1 to T12, and it connects the 12 pair of ribs. Okay, and making them 24 ribs. 12 pair of ribs making and 24 ribs. This here and here. Okay, makes 24 ribs. And these ribs originated from the spine. So this one is the front side of our of the human body, that is in front side, which is known as sternum. This one is a sternum, that is in the chest region, you can see, that is in sternum front side. And from the back there is a spine, you can see here the spine back side. So these ribs originated from the spine at the back and curves around the chest and meets in the middle to attach the sternum. Okay, and there are 7 pair of ribs, which is known as the 1 to 7, which is known as the true ribs, which is also known as the vertebro-sternal ribs. Okay, so next one, from the 8th, 9th or 10th rib, these are the false rib. Hmm? Because they do not attach directly to the sternum. Okay, instead that what happens, the cartilage meets together in the cartilage to the 7th rib, and there are the 11th and 12th pair of ribs, that is known as the floating ribs, because these do not connect the sternum. Okay, so this is an thoracic vertebrae. So here structure taken, this one structure has been taken here. So this is an thoracic vertebrae. This is an ribs. Okay, right and the left. And this is sternum, that is in the chest front region. Okay, so this small thoracic vertebrae taken here. So in this thoracic vertebrae, this area is known as lamina. This is the spinous process, and this is the back centrum. This is costal. This is known as the vertebral foramen, and this is superior articular fascia, and this is transverse process. This is spinous process. Okay, and this between these thoracic vertebrae and the sternum, there is a thoracic cavity. Okay, so coming to next, that is lumbar. So lumbar vertebrae is 5 in number, L1 to L5. Okay, so these are called the weight bearing vertebrae because they carry the maximum weight and support the entire body, upper body. And they also protect the spinal cord and the nerve root passing through them. These are the spinal cords or the nerves. You can see here also the nerves, also you can see here nerves. These are passing through them. Okay. And these also allow the wide range of the motion here. So coming to next. So this is an lumbar, this is an full vertebrae. This is an lumbar region lower, and this is an superior view where it is an one of the vertebrae taken here from the superior view, and the lateral view where this is an pedicle. Okay, this is a spinal canal. This is an body, transverse process, spinous process. Okay, and in the lateral view you can see here this is an body, this is an lamina, this is spinous, and this is in transverse process. Okay, so coming to next, sacrum. So what do you mean by sacrum? And this is an sacrum region, okay, which is you can see here, this is triangular bone. So this sacrum is 5 in number, S1 to S5, okay, but when it is fused, it becomes 1 in number. So the word sacrum comes from the Latin term, which is known as the sacred bone or the holy bone. Why it's called holy bone? Because the ancient people believed that this sacred part of the body is indestructible, and some cultures also thought, like some Yahudis, it was seat to our soul and connected to life and the death, and it is commonly used for the religious sacrifices. So it becomes to known that this is an sacred or the holy bone. Okay, so this sacrum, 5 in number, this is a triangular bone, triangular at the bottom of the spine, and it's made by fusion of the 5 vertebrae, and it connects the spine to the pelvis. Okay, it's connect the spine to the pelvis, that is hip bone, and it also supports the body weight and helps us to stand or walk or the balance. So the sacrum isn't simply a triangular bone, which is having the fusion of the S1 to S5, connect the spine to pelvis and support the weight. So here you can see that there is in some foramina, you can see the 4 pairs of small hole in the front or the back of the bone, 4 pairs of holes, and the connection points are hip connection. Uh, that is an sacrum consists of the left or the right hip bone. This connection is known as the sacroiliac joint. Okay, so there is a back connection. The very top connects our lower back. So this one is simply a sacrum. Okay, 5 in number fused together to make an one strong and solid bone. Okay, so there are the 4 holes, 4 pair of holes you can see here in the front or the back of the bone, and these holes let nerves that and the blood vessels passes from the spine down to the legs. Okay, so it's simple. So here is an beige, this is in sacral ala, this is in sacral foramen, transverse lines, this is in transverse line, this is an apex, and this is in coccyx in the last or the tailbone. So coming to next, that is coccyx. So it is commonly known as the tailbone, and there is a no function of this, and because it is a vestigial tail, this is an vestigial because it's considered as the evolutionary remnant of the tail that ancestors using have to. Okay, and this is an commonly the tailbone and smallest part of the spine, and it sits right below the sacrum, and it is a tiny triangular small bone pointed towards and fused bone. It starts as 3 to 5 small bone segments fused together into one piece as we grow up. Okay, so in our childhood there is an separate word segment, bone segment, 3 to 5 in number, but as we grow up this fuse to form one piece. You can see one piece. So coming to next, that is the nervous system. In the nervous system there is in 3 parts. Okay, that is an central nervous system, peripheral nervous system, and autonomous nervous system. Okay, so in the central nervous system, there is in 2 parts, that is an brain and the spinal cord, and the brain having the 3 parts. Okay, that is an pons, medulla oblongata, cerebellum. Okay, so in these are the peripheral nervous system, that is sensory components, motor components, which forms in spinal nerve. Okay, so let's see. So spinal cords and the spinal nerve. Okay, so let us consider that this one is brain. This is our brain. Okay, and this one is a spinal cord. Okay, so The nerves, these are the red lines, which is known as the nerves, as I show here. These are the nerves. Hmm? And the spinal cord, these are also the nerves. So the nerve which is emerging from the brain is known as the cranial nerve, which is 12 in number. It is showing here 3, but it is 12 in number. Just example I have given. So the nerves which is emerging from the brain is known as the cranial nerves, which are 12 pair. Okay, and nerves which is emerging from the spinal cord, these are the spinal cord is known as spinal nerve, and these are 31 pairs. And there is an hollow space in the brain to the spinal cord. Okay, this one is spinal cord, and there is a hollow space, and these space contain nothing, just a fluid, which is known as the cerebrospinal fluid. And when these two nerves, the brain nerve that is in cranial nerves and the spinal cord nerves that is spinal nerves, constitute to form an peripheral nervous system, and which is known as which is forms an peripheral nervous system. Okay, so coming to next. So the spinal cord, as we see that the spinal cord which is located inside the vertebral column. This is a spinal cord, and these are the side one is the vertebrae. Okay, so these vertebral column having a hollow space, and in that hollow space that spinal cord runs. Okay, and it is an that vertebral column is an providing an structural support and protect the spinal cord. So we can describe as the spinal cord is a thin tube-like structure begins from the medulla oblongata of the brain. The brain having the three parts: pons, medulla oblongata, and the cerebellum. So from the medulla oblongata, the this thin tube-like structure begins to the brain and extends down to the first and the second lumbar vertebrae. It's at the first and second lumbar vertebrae. And these spinal cord regulates the controls many reflexes action. And these are cylindrical in shape. You can see these are cylindrical in shape. Hmm. So also there is in cervical C1 to C5, T1 to T12, L1 to L5, S1 to S1. So these are the structure, these are the spinal cords. Okay. Coming to next. Spinal cord segment. Okay. So the spinal cord segment. So cranial nerves are the nerves that arises from the brain. We all know that the nerves which is arises from the brain is known as the cranial nerve, and the spinal nerves, the nerves arises from the spinal cord. Together, cranial nerves and spinal nerves forms the peripheral nervous system. So the spinal cord is divided into 31 segment. Okay, so the spinal cord divided into 31 segments. So the 31 pairs of the spinal nerves, so the spinal nerves are 31 in number, 31 pair arises from them, and the number of segments just matches to the number of the nerve pairs exactly. Okay, so here the cervical having the 8 pairs, but in the vertebrae, cervical vertebrae, how much we see that the 7 pair. So we'll see that why it's 8 pair. So these are the nerve pair. Okay, these are the pairs of the nerve, spinal cord nerves, spinal nerves. So cervical 8 pairs, thoracic 12 pair. These are the nerves. These are the nerves. You can see here. Sacral 5, coccygeal 1. So the cervical having the C1 to C7, but here the nerves, if we talking about the nerves, then it is an 8 because this C1, this C1 region from the above of the C1, that nerve starts, that nerve emerges. That's why the cervical having the 8 pairs of the nerves. Okay. So coming to next, covering of the spinal cord. Okay. So the spinal cord is protected by the vertebrae. Hmm? Spinal cord is protected by the vertebrae, and it is also covered that is spinal cord. This one is a spinal cord, and it is protected by the vertebrae, and These vertebrae also, these also, that spinal cord also protected by the layers, some three layers, which is known as meninges. And also these layers are the dura mater, arachnoid matter, and the pia mater. So the dura mater, which is an outer layer, this one is a spinal cord. You can see here, this part is taken here. This is a spinal cord, and this spinal cord is also protected by some three layers of the tissue, which is known as the meninges. Okay, so these three layers are dura mater, which is an outer layer, hmm? and the arachnoid layer, which is an the middle layer, hmm? and the pia mater, that is in the soft innermost layer, and and you can see here, this is an this one taken here. Okay, this is an encephalon pia mater, this is an pia mater. Okay, this is an arachnoid matter, this is an dura matter. Okay, so if you see that there is some spaces between the pia mater and some spaces between the dura matter. So the gap between the dura matter and the arachnoid matter is known as the dura mater and the arachnoid matter, that is known as the subdural space. And the gap between the arachnoid and the subarachnoid space, arachnoid and the pia mater, that is an arachnoid and the pia mater, which is known as the subarachnoid spaces. Okay, the spaces between the dura mater and the arachnoid is known as the subdural space. Okay, subdural. And the space between the arachnoid matter and the pia mater is known as the subarachnoid space. Simple. So these are the covering of the spinal cord. This is look like some butterfly structure. Okay, coming to next. So, so the structures at the end of the spinal cord and its enlargement. Okay, so the spinal cords, this is in spinal cord, these sides are the vertebrae, and this spinal cord ends around the L1 to L2. You can see here this spinal cord come here and L1 to L2 region, this ends. Okay, at this end, you can see here at this end, these make and forms an cone-like structure or shape, which is known as the conus medullaris. This is known as conus medullaris. And below the L1 and L2, the spinal cords end, but never keeps the hanging down. So the next one, the some bunches nerves look like horsetail. These are the bunches you can see as a bunches. Okay, so it's make an cauda equina. Okay, and the thin strand of the pia mater. So in the thin strand of the pia mater extend down all way to form, which is known as the phylum terminable. Okay, and in this spinal cord, there is enlargement. In some places, you can see here there is some enlargement, some upside down, upside like that, or enlargement in the spinal cord. So in the spinal cord enlargement, there are the two thicker plates. Okay, so the first one, there is two spinal cord enlargement, that is in cervical enlargement, which is in upper side, which starts from the C4 to T1. C4 to T1, that is an cervical enlargement. And the lumbar enlargement, that is an T9 to T12. T9 to T12 is the lumbar enlargement, that is on lower side. Okay, coming to next. So the internal structure of spinal cord. So this is an internal structure. If we cut the spinal cord horizontally, or we do this cross section, it look like that. So inside, that is known looks like a butterfly, and in the inside the butterfly there is a gray matter, hmm? and there is an outer layer which is known as the outer surrounding is known as the white matter. This is just opposite to brain. In the brain, this in the brain, the gray matter is outside and the white matter is on the inside. Okay, but in the spinal, there is an the gray matter is in the outer side, that is an the gray matter is in the outside, and the white matter is in the inside. Okay, so the gray matter, you can see here the gray matter. This is a it is made up of the neural cells bodies or the dendrites. Okay, so the neuron in the one of the neuron structure, there is a cell body and dendrites. It makes the gray matter. Okay, that cell bodies contains the nasal granules and gives the grayish color. And in the white matter, that is made up of the axon. And axons covered with the fatty layers, which are known as myelinated sheath. That fatty gives this shiny white color. That's why it's in gray and white color. So this is simply an internal structure of the spinal cord. Okay, going to next. So there is a reflex activity which is controlled by the spinal cord. We can simply define this reflex activity as an involuntary, immediate or the autonomic response of the effector organs like the muscle or the gland to a specific stimulus. This means our body react instantly to danger without waiting our brain to think about it. Okay. So these are the simple anatomy, basic anatomy of the nerve or the nervous system. Okay, or the spine. So, what the physician will do in the spine surgery? Okay, so in the spine surgery, first the physician will do the imaging. Okay, imaging like the CT, MRI, X-ray. After that, he will confirm the levels or inform or confirm the level or identify or which are the levels are involved. After that, he will administer the anesthesia. I will give the anesthesia to the patient. After he will position the patient and makes the surgical incision to expose the spine and removes the bone or the soft tissue compressing nerves, which is known as decompression. And after that, he will remove the all or damaged disc if needed, perform sometimes fusion when stability is required, inserts and instrumentations like the pedicle screws, rod, case, plates if needed, correct the deformity if present, confirms the decompression and alignment, and after that he will achieve the hemostasis, screws the wound in the layers. Okay, so coming to next. So these were the ICD. Okay, so these were the diagnoses. You can see here the lumbar disc disorder, radiculopathy, lumbar disc disorder. These are the M series code, some G series codes you can see here. So they are the some terms I will explain one by one in the simple way. Okay. So the cervical disc disorder with radiculopathy. So what is this? A damaged or the herniated disc in the neck region or this cervical neck. So here the spine compresses the spinal nerves and it will cause a nerve pain, shoulder pain, or numbness or tingling or weakness. Okay, so these are the diagnoses. Second one, that is lumbar disc disorder with radiculopathy. This is radiculopathy is just a compression of the nerve root. Okay, inflammation in the nerve root. Okay, so the lumbar disc disorder, it is a damaged or herniated disc in the lumbar compresses spinal nerves. Okay. The third one, lumbar spinal stenosis. This is a narrowing of the spinal canal in the lower back or reduce the space for the nerves. It was also the symptoms will be the like weakness, leg pain, back pain, numbness, or difficulty in walking. Okay. So the next one, that is thoracic spinal stenosis. What is this? Thoracic in the spine, narrowing of the spinal canal in the thoracic spine or the middle back. Okay. Spondylolisthesis. As we already discussed, what is a spondylolisthesis? That is one of the vertebra slips over another. Okay. It makes the spine unstable. Next one, scoliosis and kyphosis. These are the spine uh, abnormality, curvature, abnormal curves of the spine, that is scoliosis or kyphosis. And degenerative disc disease, which is an we can say that the age related or wear or tear causes spinal disc or lose weight or height. So next one, radiculopathy. Radiculopathy is nothing in compression or the irritation or inflammation of the spinal nerve root. Okay. Sciatica. Sciatica is nothing just in compression of the sciatic nerve, usually from a lumbar disc herniation. Now, next cervicalgia. Cervicalgia, that is a medical terms for the neck pain caused by the muscle strain or the injury or the disc problem. Now, next one, that is compression fracture, that is collapse or of the vertebrae, that is a break in the vertebrae, commonly due to the trauma, cancer, or due to osteoporosis. Hmm. That will the symptoms, maybe you can also see that the sudden back pain or pain loss in the loss or the spinal deformity, that is in compression fracture. The next one, that is an spinal cord compression, that is in pressure on the spinal cord caused by the disc tumor or the infection or stenosis. Now the next one, that is cauda equina syndrome, that is in compression of the bundle of the nerves at the lower end of the spinal cord. Okay, and osteomyelitis of the vertebrae, it isn't just an bacterial or the fungal infection affecting the vertebral bone. Epidural abscess, what is this? This is an collection of the pus in the epidural spaces uh, around the spinal cord or due to the infection. Or next one, that is benign neoplasm, that is a non-cancerous tumor or around the spine. Okay, so these were the spinal disorder affecting the bone disc nerve or spinal cord. This may cause the pain, numbness, weakness, or deformity, and the treatment depends on the severity and may include the medication, physical therapy, injection, or if these fails, then spinal surgery. Now, next one, that are the types of spine surgery. So, there are several types of the spine surgery. So, first one, that is discectomy, microdiscectomy. So, what are these? And the CPT codes will be the 630 or 635. Okay, so discectomy is in surgery or the procedure in which the surgeon will remove the damaged part of intervertebral disc, okay, that pressing on the spinal nerve. Okay, and microdiscectomy, you can say same surgery, okay, but performed using an operating microscope, making it minimally invasive with a smaller incision. And why this procedure is done? To relieve the nerve compression caused by the herniated disc, radiculopathy, leg pain, numbness, or the sciatica, muscle weakness. So in this procedure, what will physician do? So first of all, what are this procedure? This procedure, you can see that this is an this procedure 630 I will show you in the book 630. 630. So this one is the laminotomy. This one is the laminotomy with the decompression of the nerve root, including the partial fasciectomy, foraminotomy, excision of herniated disc, one interspace lumbar, and 630, 35, that is, and the each additional interspaces of the cervical or the lumbar. Okay, so this one is the uh, my discectomy procedures. Okay, so in this procedure, let me, okay, so in this procedure, what will physician do? In discectomy or microdiscectomy, what will physician do? Physician will make some small incision, okay, and may perform the small laminotomy to reach the disc and identify the compressed nerve root, identify the compressed nerve root and removes that disc fragments. And he will also ensure that the nerves will be free. And after that, he will close the incision. So simply discectomy is an nothing, just an laminotomy will perform. Small incision has been done to remove and identify the compressed nerve root and removes the herniated disc fragment. Okay. So coming to next, here in the discectomy also one thing more, that disc material has been removed. Okay, or nerve root or the spinal cord is decompressed here, and the lumbar interspaces is treated. One lumbar interspaces is treated. And now coming to next, that is an laminectomy. So laminectomy, the CPT code will be 634-748. So this is a decompression surgery or a procedure in which all or the most of the all or the lamina has been removed to create more spaces around the spinal cord or the nerve root. It is used to done for the spinal stenosis, nerve compression, spinal cord compression, back pain, numbness, leg pain, etc. So in this physician will what physician will do? So in this 634-748, what this CPT are? These are the lumbar laminectomy. Okay, first and the additional procedure, lumbar laminectomy. But here the physician, what will physician do? Physician will similarly, he will do the incision, remove the part or the all part of the lamina, removes the ligamentum flavum if needed, and removes the bone spur if present, and frees the compressed nerve. Okay, so in the here the neural decompression is the primary goal. Okay, so coming to next, that is laminotomy. So what do you mean by laminotomy? Laminotomy is then removes only a small portion of lamina instead of the entire lamina. It creates a small window to reach the nerve or the disc. It is done for the spinal stenosis, herniated disc, nerve root compression, to perform the microdiscectomy. Okay, to perform the microdiscectomy here. He will also remove the lamina, create the spaces for the access of nerve, or removes the tissue compressing the nerve if needed. Now coming to next, that is an uh, foraminotomy. So foraminotomy is a decompression or surgery in which the neural foramen, that is an opening of the where the spinal nerves exist, is enlarged. Okay, and it is done when the nerve is compressed because of the bone spurs, arthritis, the disc bulging of the disc, and the foraminal stenosis. And here the codes are 630-20 or 630-35. These were the cervical reason. Okay, these were the cervical reason foraminotomy. Okay, cervical laminotomy, foraminotomy of the nerve root compression, and some of the another additional procedure will be also there. So in this, the physician, in the foraminotomy, physician will what to do? Physician will just locate, he will just see the neural foramen and removes the bone or the tissue, narrowing the opening and enlarge the foramen and freeze the nerve root. Okay. So here the 630-20, there will be the coding criteria that the cervical laminotomy and or the foraminotomy is performed, nerve decompression is must be documented here. Okay. So I have just given the verbal. Okay. What will physician do? The next one, that is an spine fusion, spinal fusion, or we can say that the arthrodesis. Okay, so simply think about that, that two loose bricks moving painfully against each other. Okay, when two of the brick, that brick from which our house is made. Okay, think about that brick. So think about that brick, and just there is two loose bricks moving painfully against each other. So the surgeon what will do? Fixes those bricks together using and some screws or bone so that it become one strong brick to stop moving, to relieve the pain. Okay. Similarly, the arthrodesis is a procedure in which two or more of the vertebrae which are loosed, that's why permanently fused together using an bone grafts, metal implants to stabilize the spine and to eliminate the painful movement between the vertebrae. Okay, so some of these steps while doing the arthrodesis procedure, while doing the OPs of the procedure, there were some steps to need to be followed. That is an case interbody fusion. First of all, the step one, that is an types of fusion, we have to know that. Okay, that is an case interbody fusion. Example, ACDF, that is anterior cervical discectomy and fusion. Okay, and posterior lumbar interbody fusion, transforaminal lumbar interbody fusion, anterior lumbar interbody fusion. So, what are these? So, the anterior cervical discectomy fusion means that the spine is cervical, which is a neck, approaches is front, that is anterior here showing, and the procedure that is removes the damaged cervical disc, discectomy. It means that the removal of the damaged cervical disc, and after that the placement of a bone graft or a cage to fuse the two vertebrae, and it is used for the cervical disc herniation, radiculopathy, cervical stenosis. So understand that why, what is this? This is a spinal reason is the neck, cervical, that is neck, and which is an approaches is anterior, that is in front, and discectomy is performed to remove the damaged cervical disc and place an bone or the graft or cage or to fuse the two vertebrae. That's why it's fusion. Now next, that is an PLI, that is an spine is lumbar. Okay, approaches is backside or posterior. Procedure to remove the damaged lumbar disc from a back and inserts a cage or a bone graft to stabilize the with the screws or rod, which is used for the degenerative disc disease like spinal instability, etc. Now coming to TLIF, that is an transforaminal lumbar interbody fusion. So here the spine is lumbar, approaches is back from one side, transforaminal means back from one side, back from one side, and the procedure to remove the disc through one side place of the interbody cage or a bone graft to fix the with the screws or rods. Okay, now the posterior lateral, some another anterior lumbar interbody, etc. So these were the few simple conclusion will that the this step one is very important, that is a type of spinal fusion surgery while going while or spinal surgery while seeing the OP report, we have to need to check the types of fusion. Okay, so these were the CPT codes reason, that is 22551 to 22558. Okay, and 226002634. Now coming to next, the step 2. Notice that the physician will use interbody means physician will use the case. Okay, physician will use the interbody. It means that the physician will use the implant and the disc material is removed and case is placed in spinal disc or disc space, and also the interbody device is fused with graft. Okay, so this step 2 is in surgical approaches. Already approaches, what is, they are the main three approaches, that is and the uh, anterior, posterior, lateral. So these surgical approaches to access the spine. Okay, the main approaches, that is anterior, that is in the front, which means that surgeon will reaches the spine from the front of the body. These were the key points. Okay, and how it's done, how this anterior, how it's done. An incision is made of in the OP report it's written like the incision is made from the front of the neck or front of the abdomen or surgeon will gently move the organs or blood vessel aside to reach the spine. Okay, so the terms were the retroperitoneal. Okay, the surgeon will reach the lumbar spine going to behind the abdominal lining or the peritoneum without the opening of the abdominal cavity. Now the second one, that is the abdominal approach. Here the physician will do the entry through the front of the abdomen, that is anterior side, and the blood vessels are the carefully moved aside the safely to access the spine. So these were the approaches. Okay, an example like the anterior cervical discectomy and fusion is ACDF or ALIF. Okay, so coming to next, that is and the posterior approach. Posterior approach means back, which the surgeon will reach the spine through the back. So how it is done? The patient, some in the OP reports, it's look like the patient lies in the prone position or the face down, or the middle posterior incision, which is made in the center of the back, and the back muscles are separated to expose the spine, or terms maybe the prone, lamina exposed, okay, facet joint visualization, and also perform on the facet joint exposed, so the surgeon can perform the decompression or place the screws. Example PLIF, TLIF, etc. Now, the third one, that is lateral approaches, that is on side, meaning the surgeon will reaches the spine from the side of the body. Here, the physician will, in the OP report, it's look like that the surgeon passes through the um, mm, around the psoas muscle to reach the lumbar spine. So the transverse approaches, that the surgeon goes through the psoas muscle, direct lateral axis, the spine reaches directly from the side. Okay, and like LLIF, that is lumbar left lateral interbody fusion. So there will be a smaller incision. Okay, and some less damage to the back muscle. So this one is the step 2, anterior, posterior, lateral. Okay. Now the next one, that is step 3, which is an instrumentation used. So instrumentation uh, used, why instrumentation done? To stabilize the joint. Okay, so there are two, that is an interbody devices or cases. So what are these? These are the small implants, okay, called cases, placed into the disc spaces, placed into the, these are the disc spaces after the damaged disc is removed. When there is a disc, when this disc has been removed, then these cases has been placed there. Okay, materials like the PEEK, which is known as the polyether ether ketone, and next one is titanium, which is in strong very strong biocompatible, or the promote the bone growth. And the next, that is an that is an which is placed into the disc spaces or grafted. Okay, and the next one, that is an posterior instrumentation, that is an pedicle screws. These implants were placed from the back or the posterior of the spines. Pedicle screws inserted into the pedicles of the vertebrae. This one is the vertebra, and pedicles of the vertebrae, these screws has been placed, which provide a strong fixation to stabilize the vertebrae. And the rod, that is a metal rod. Okay, these were the metal rods you can see here, connected to that pedicles. Pedicles, the connected rods has been connected to the pedicles to keep the spine aligned and stable. And the lateral mass screw usually used mainly in the cervical spine, which is used and which is inserted into the lateral mass instead of the pedicle. Hmm? Okay, and the segmental fixation, that is fixing involving the multiple vertebrae segment using a screws or rod, and it provides a stronger stabilization for the long spinal fusions. Okay, so these were the instrumentation used. These were some key points which is used in the OP also. Now, Moving to next, that is a step 4 or step 5, that is a use of the bone graft and the source. So the bone graft, which helps the two vertebrae to fuse into one solid bone, and there may be the autograft, allograft, or synthetic graft. Okay. So in the autograft, bone taken from the patient's own body, as we know that. So here the laminectomy site or the iliac crest site, there is an best healing, no risk of rejection. Okay. Or allograft, that is a bone taken from the donor of the cadaver. Okay. DBM, you can see here DBM, demineralized bone matrix or freezed, dried. Hmm? And synthetic, which is used infuse BMP or the ceramic substitute. These were the some terms which is used in the OP for the synthetic graft if it is used. Now the next one, that is in step 5, that is an graft determination. It means that is then surgeon will chooses the types of graft based on the surgery. Sometimes he will use a structural graft, sometimes the morcellized graft. So what is a structural graft? The structural graft, the solid piece of bone used to support the spine and maintain the disc height. Hmm? And morcellized graft, which is a crushed bone piece, crushed bone chip packed around the cases, screws, disc space to promote the bone fusion. So these were the graft determination. Step 5. Now coming to the last, that is we have to check while doing the arthrodesis, that is in spinal arthrodesis. We have to check the additional procedures like the um, any laminectomy, foraminotomy, discectomy, nerve root decompression, or ligamentum flabum has been removed or not. We have to check that additional procedures while doing the arthrodesis procedure. Okay, so these were the last step. And here the laminectomy, which is the removal of the lamina, back part of the vertebrae, and it will foraminotomy, that is an enlarge the neural foramen, and that is discectomy, that is an remove the damaged or herniated part of the intervertebral disc, and the nerve root decompression, that is the freeze or compressed spinal nerves. Huh? And the ligamentum, that is an phlebum, that is an removal of the thickened ligamentum phlebum to create and spaces in the spinal canal to relieve the spinal instability. Okay, so this is an important note that before assigning any CPT codes for the decompression, okay, we have to know that we have to ask a question like why the decompression, why was decompression done? That is, we have to check the intent. Was it done with this done to treat the spinal stenosis, foraminal stenosis, or herniated disc? And if it is done, then code it separately if meets the CPT criteria. And we have to also ask the question why it was done. Was it done only to allow the spinal fusion or case placement? Okay, so we do not have to code the decompression separately because it isn't considered as the part of the fusion procedure. Hmm? Okay, so we have to check the intent of the decompression procedure, why this perform, whether for it nerve root release or discectomy. Then check the post-operative diagnosis as a stenosis of spine or foraminal stenosis. If decompression performed for spinal fusion, then no need to code the decompression. Okay, coming to next, that is corpectomy. So this corpectomy, we have to know that what this term is. So corpectomy means removing the part of the entire vertebral body to relieve the pressure on the spinal cord or the nerve. So these were some CPT codes 638.1, 638.2. So what this CPT is and why it's done and what will physician do. So we will see one by one, that is 638.1, and this 638.1 or 638.2, these were the cervical corpectomy or some additional cervical segments, thoracic corpectomy or additional thoracic segments, etc. So these were the cervical corpectomy codes. So this why what this procedure is done? Why is procedure done? So when the that there is large disc herniation behind the vertebral body, okay, or the spinal cord compression, or the myelopathy, or the spinal tumors, hmm, etc. So this corpectomy is done for the spinal cord compression, spinal tumor, vertebral fractures, etc. So the physician will makes an incision. He will give the anesthesia, makes an incision to that cervical region or the spine, and removes the damaged vertebral body, and removes any disc fragment pressing on the spinal cord, decompress the spinal cord, or release the spinal cord or the nerve root, and places on some graft or cases in the empty space, and stabilize the spine using a plate or screws, or instrumentation will be done. So code depends upon the this corpectomy code depends upon the reason. Okay, spine reason, cervical, thoracic, lumbar, or we have to check that whether it is done for the partial vertebral body or complete, and we have to check the number of vertebral body removed, and surgical approach, whether it is anterior or posterior. Okay, so this is an corpectomy. Now vertebroplasty. So vertebroplasty codes will be 22510, 22511. So what are these codes? This is an vertebroplasty code, or regional, like for example, thoracic. This one is thoracic vertebroplasty. This one is the lumbar vertebroplasty. Okay, you can check in also in the books. Hmm? So why this vertebroplasty? What is this vertebroplasty? It is an invasive, minimal invasive. It means a small incision has been given where the bone cement injected into the fractured vertebrae. Okay, injection of the bone cement into the fractured vertebrae. It is done for the painful vertebral fracture, cancer, vertebral instability. Okay. Mm. So physician coding criteria will be have to check the reason. Which reason, lumbar, and first treated, which one is the vertebrae. Additional vertebrae we have to check that. Image guided is included or not. Okay. For the kyphoplasty, this one the CPT code, that is 22513. So this one is the similar to the vertebroplasty. Okay. But here the balloon is inflated first to restore the vertebral height before the cement is injected. Now next one, that is an hardware removal. So hardware removal, that is 22852, 22855. So these were the when the previously implanted spinal hardware such as the plates, rods, screws, hooks, or cases. So this is done for the when the implant is loosening, implant breakage, infection, pain due to hardware, fusion which has healed and hardware no longer needed. So the reason so that the hardware removal has been done. Next one, it is artificial disc replacement, which is an replacement of the diseased disc with a prosthesis. Hmm? So these were the CPT code for artificial disc. And coming to next, that is an lamino. So artificial disc replacement, we can say that removal of the damaged spinal disc and replace it with an artificial implant to relieve the pain while preserving normal spine movement. And the coming to next, that is an laminoplasty. So this laminoplasty, that is 63050, where which is done. Okay. So laminoplasty is an enlarge the spinal canal while preserving the lamina to relieve the spinal cord compression. Okay. Instrumentation which is used to using like a screws, rod, or hooks or cases to stabilize the spine during after surgery. To stabilize the spine, it is done after a spinal fusion, spinal fracture, spinal deformity, or the tumors or instability. Hmm. Coming to next, spinal decompression, that is to relieve the pressure on the spinal cord or the nerve root. Revision of spine, revision in the revision of the spine, the second surgery performed to correct the or to improve the results of the previous spine surgery. Okay, and Tumor excision with spinal stabilization, that is removal of spinal tumor followed by the stabilization and of the spine using instrumentation or the fusion. Okay, so these were the uh, coding criteria for the arthrodesis. Coming to this one is the what are the types of the spinal fusions. Okay, so these were the types of the spinal surgery. Okay, so these were the types of now coding criteria. So in the coding criteria, first the diagnosis documented and medically necessary. We have to always check the what is the diagnosis given. Okay, then we have to second find that what are the exact spinal reason, whether it is cervical, thoracic, lumbar or sacral. The third one, exact vertebral levels. For example, levels are C2, C5 to C6, L4 to L5. Okay, we have to check the exact vertebral level. Then the fourth one, that is an approaches, which may be anterior, posterior, lateral or the combined. We have to check that. Now the fifth one, that is procedure performed. What are the procedure performed? Whether it is decompression, whether it is fusion, whether it is discectomy, whether it is corpectomy, etc. We have to check whether it is an open versus percutaneous endoscopic technique. Okay. And the next one, that is whether it is in primary or the some additional levels. Instrumentation inserted or removed. Or the next one, that is interbody case device placement. Bone graft types we have to check. Hmm? Any use of the microscope, navigation, fluoroscopy, if it is separately or only if separately reportable or not bundle. We have to review the NCCI edit also to avoid the unbundling procedures. We have to also apply the modifiers when it is needed. Hmm? So these were the coding criteria. Hmm? Now, next, we'll see some OP reports. We'll see the OP reports. Now, this one is the OP report one, that is an pre-operative diagnosis, that is a lumbar disc herniation at the L4 to L5 lumbar radiculopathy, and posterior diagnosis, that is same. Procedure is left L4 to L5 laminotomy, microdiscectomy with the decompression of the left L5 to nerve root, anesthesia general. Indication: the patient has several low back pain radiating to the left leg. MRI demonstrated to large L4 to L5 herniated disc compressing the left L5 nerve root. Conservative treatment failed. So the procedure done. The patient was placed in prone after induction of general anesthesia. L4 to L5 level was confirmed using fluoroscopy. A midline incision was done and paraspinal muscle was dissected to expose the lamina, and left laminotomy was performed. Ligamentum flavum was removed and the left L5 nerve root was identified and gently retracted, and herniated disc fragments were removed using pituitary Ronniger's and using microscope visualization. Microdiscectomy. The nerve root was completely decompressed, hemostasis was achieved, and the wound was irrigated and closed in layer. So, in this OP, main thing first, that is an what are the reason of the spine. So, while reading this, we understand that that is an lumbar spine reason. Lumbar spine reason. After that, we have to check the interspaces. Why interspaces we have to check? Because as it is written, that is discectomy. It means disc has been involved. That's why we have to check the one interfaces. Okay, and here also the herniated disc. It means that it is discectomy. It means disc has been involved. Okay, disc has been involved. That's why we have to check the and microdiscectomy is done. and the nerve root was completely decompressed. It means here is a radiculopathy, which means the nerve root compression. So this compression should be decompressed. That compression should be released. So the nerve root was completely decompressed or radiculopathy problem. Okay. This Paul op is saying that this is an laminectomy and microdiscectomy procedures. Okay. So we will navigate this. Okay. So we'll navigate this procedures. Mm. Example, the patient having the 24 age of admission. Product should be. So here, what is the ICD? Lumbar disc herniation. Okay. So we will navigate by the term herniation. Okay. After that, there is a disc involved. Lumbar disc herniation. So this is an intervertebral disc talking about. Okay. So disc. After that, the lumbar region and lumbar intervertebral displacement. Any radiculopathy involved? With myelopathy, only radiculopathy. So this one. No, already coded. No. M5116. Okay. So this one is the ICD for this. Now, for the next, that is an laminotomy. Okay. So we will navigate the term by laminotomy. After that, decompression of the nerve root. Yes, it means radiculopathy. And after that, we have to other unspecified. Other unspecified. Other. And after that, we'll choose the lumbar region. Posterior side. Posterior why? Because it is in prone. Prone means posterior side. And after that, the posterior, the other unspecified. Okay. Unilateral. Only one interspaces. No. 630. 30. So this one is the laminotomy with decompression of the nerve root. It means radiculopathy, including the partial fasciectomy, foraminotomy, and or the excision of the herniated intervertebral disc. Okay, and or. So here herniated intervertebral disc. Okay, excision, and one interspace is lumbar region. Okay, so this one is the example of the OP. So this is so much large video. So just comment for this that if anyone wants the OP report for OP report example of this topic, then there will be another playlist. Okay. So thank you guys. Just like and subscribe my channel. Okay.